Thank you very much, Chairs, and the organizing committee for giving me the opportunity to talk in front of the elite and august audience. Thank you very much. So what I want to talk today is talk about heat vulnerability among the working population. NIOH is the right forum for me to talk about it. And I want to substantiate what we found with our own studies and what we have done in India. Just not Ramchandra's studies, but we want to do it from what studies we have done, what evidence we have generated from our own population. Many people have spoken about it already. We are seeing a predicted rise in temperatures, which is going to be impacting billions of working people across the world. And when we speak about workers, we speak about WBGT. I will try and limit the number of jargons that I will be using today, because I know that there are a lot of climate scientists working in diverse areas. So I'll try to make it as simple and as easy for everybody to understand. And when you're speaking about temperatures for workers, we speak about wet bulb globe temperature, which is an index that's used that kind of simulates our body's temperature and how we react towards heat. So we are expecting about 38 to 46. This is what has happened in the last few years. And another important factor, most of the time that's ignored, is people only speak about the average dry bulb temperature, and humidity is almost forgotten. But in our studies, we have found 40 to 80% of humidity that actually is impacting workers, and 91% of our study population out of about 6,000 have reported that they have experienced heat-related illnesses. And in last year, we had record-breaking temperatures, 37 cities surpassing 45 degrees Celsius, with the highest number of intense heat waves in the history. And extreme heat events introduce multi-stress vulnerability, exacerbating population vulnerability to climate event, and here we will focus more on workers, of course. By 2030, India will lose about 34 million jobs due to heat stress. It's not like people are not going to continue working, but they'll be losing so many hours, working hours, because they cannot continue to work in that kind of heat. And India's GDP may decline by 4.5% by 2030, which is almost equivalent to about $29 billion in just 7 years. So it's very close to us now. We have all this reported all the time. Gujarat and Ahmedabad, of course, 82% of all cases have HRI cases. Mumbai, there had been issues. How many of these are documented? How many of these is undocumented? The documentation when it comes to heat-related illnesses is just starting in India, the last few years. So we don't even have most of these documentations done. Tamil Nadu, we have started documenting it from last 2 years ago. And then we had the highest temperatures, which was 7.4 degree above the average last year. So what happens? Heat fatalities. And again, I'm just talking about the documents that we have, what kind of data has been documented. In 2019, 46,562 people killed in India. I personally think this is a very underreported number. And India's NCDC calls heat stroke as a life-threatening condition with mortality rates of 40 to 64%. And deaths due to heat has tripled in the last 20 years. It is just not deaths we are talking about. We are talking about disabilities, which is happening globally. 0.4% of the global burden and 10% of India's DALI. So what actually happens? How is the vulnerability created, especially for the workers? One is the heat, stress, and humidity that I've spoken about earlier, but also the kind of poor welfare facilities or level of ventilation in the workplace, what kind of metabolic workload is created inside the body, which is equivalent to the heavy physical workload these people are working, and the lack of automation, which kind of reduces the workload. So these all put together creates the vulnerability for these people, which varies for different. But also there are other risk factors that exacerbate the heat vulnerability for different kinds of working population. Lack of acclimatization. When I come to my next slides, you will see what means acclimatization for certain worker populations, clothing, the kind of uniform that's been given to these people, lack of automation. When it comes to workplace welfare facilities, unscheduled rest breaks, poor welfare, including water and toilet access to these workers, physiological and health factors. We spoke about age, gender, what are the comorbidities do they have, what kind of health condition do these workers work in. Other conditions like socioeconomic disparities, the living conditions, the kind of protective gear they get, and then access to medical care if any of them are affected by heat. Who is vulnerable? Elderly workers definitely, child laborers, migrant workers, pregnant women, and workers working in small and medium enterprises. Why should we focus on vulnerable populations? The heat impacts people very, very disproportionately. Only certain worker groups are more affected than the other groups. Migrant workers who frequently move, they are usually in search of employment, get the labor-intensive jobs, and they don't get acclimatized as soon as they get into the jobs. Workplace conditions, sometimes social exclusion, including workplace exploitation, denial of rights, like the right to take even a 15-minute break. All of this increases their vulnerability. Living conditions, many of these poor workers live in overcrowded areas with inadequate infrastructure, restricted access to electricity, health care, illegal status, all of this. Extreme indoor temperatures also affect the small and medium enterprises who lack protections for safer working environments. Many factors. Next, please. Next. Sorry. Yeah. So let's see whether what we speak about elderly workers, there's a pathway as to how this thing happens. Elderly workers are increasingly entering the workforce now. Children are moving away because of climate change or because of want of jobs and other things, and then due to financial necessity, they have to come back to agriculture, tend their own lands, all of this. And elderly workers are particularly vulnerable to heat hazard due to a combination of physiological, psychological, and socioeconomic factors. And about 82 to 90% excess mortality happens among elderly adults, especially the ones with the comorbidities. Usually this happens because they have a very reduced thermoregulatory mechanism. They have a decreased ability to sweat and cool down because of the age. There is also a decreased sensation of thirst, so they do not take enough fluids. That actually increases the risk of dehydration and kidney injuries as well. And there is also a cognitive decline. Heat anyway reduces your cognition. For elderly workers, it's much lower. So there is a lower reaction to the heat stress, increasing accident risks among these elderly. Also, there are other chronic health conditions that they have, such as CVD, diabetes, respiratory condition. They all, and the medication that they take, make it all much more vulnerable to heat risks. Child laborers, the tabooed word, just not here globally. I go to ILO meetings and I speak. The word child laborer is something that they do not want us to speak. But we do have child laborers. And when child laborers are engaged in heat work, the children, they absorb like heat much faster. Their sweat glands are not completely developed, so they are not able to cool down effectively. And pre-existing malnutrition, children come to work only because of their financial necessity or something. So obviously they have a pre-existing malnutrition, most of them, and that further weakens their immune systems. And extreme heat temperature increases 2 to 3 times dehydration risks for these children. Children working in extreme heat suffer from sleep deprivation. That's a new thing that's coming, just not heat-related sleep deprivation, and reduction in cognition is another new thing that's being explored. And we have an estimated 22,000 workers, child laborers in mines in Jharkhand and Bihar, mica mines, and they work in shafts where the heat and humidity is extremely high, and we have only 22,000 documented workers, and we have more coming. More than 400,000 children in India are involved in hybrid cottonseed cultivation. Because of their small fingers, they make the most suitable people to work in these cotton fields. So there is a lot of things that are coming out and saying that all this is going to be affecting children by about 2015. Another 25 years, we are going to see a lot of child laborers being affected by heat. The migrant workers come the next. Most vulnerable, they bear the unjust consequences of climate change, where they leave the least carbon footprints though. Agriculture and consumption sectors, very labor intensive, and many illegal things happen there, and these migrants are mostly working in these areas. 1 billion people are employed in agriculture workers, and another 66 million in textile industries. That's just a small stats from India. Deaths in India, most of them migrants and outdoor workers. 139 million migrants residing usually in very densely populated areas, which again increases their vulnerability. And then migrant workers are 2.5 times more likely to suffer heat stroke due to lack of acclimatization. And 80% reporting dehydration, fatigue, leading to kidney disease and other long-term health complications. 40% increased kidney disease risk due to extreme heat exposure. This has happened in Central America, which is almost similar to what we are here. Migrant workers also learn about 30 to 50% less than what the local workers do. So it makes it even more difficult. Socially, they are backward, and financially also backward. It's difficult for them to afford cooling interventions or any nutritious food. That further increases their vulnerability. 67% of the migrant workers live in overcrowded. Most of them don't even have electricity to cool themselves. It's even worse for the migrant women workers. Lack of access to toilets. One study that we conducted found that 1.7 times higher risk of urogenital issues because they do not have any access to toilets at the workplace. 2.1 times higher risk of mental health issues, various issues, but most of this is related to heat. And then productivity losses as well. So they have to continue working longer to finish their targets, so they do not have time to even take care of themselves or their families, because most of these migrant families move along with the children. And children get into mischiefs, sexual assaults and all of that. So probably that could have led to the mental health issues as well. Next is the pregnant women. Okay. Most of the informal sectors in India, pregnant women continue working even till the 9th month. The last trimester, till the 9th trimester, people work. The effect of pregnancy on women is attributed to the hormonal levels, and then again increased circulatory demands for the fetus, which also increases her susceptibility to heat-related disorders. Maternal hypothermia increases the incidence of spontaneous abortions, fetal malformation in the earlier trimesters, which we have seen in our own studies. And we've seen ambient temperature, fluid deprivation, people who are dehydrated having adverse pregnancy outcomes. Heating raises the metabolic burden, but also restricts the fetus' ability to meet its growing physiological needs, which happens more in pregnant women who are working in heat. Our own results. This is just like what I explained earlier. So the maternal physiological response is diversion of the blood to the skin for a woman to cool herself, but it might divert the blood away from the placenta because of sweating, and that leads to dehydration. That affects the child as well. We looked at certain women, 250 women workers. We had more. This is just women workers in informal sectors. 32% of them had 3.5 times higher risk of adverse pregnancy outcomes. It's been published, and it's also the first study in India to be conducted. 87% of them had urogenital issues. 22% have adverse outcome at birth. The children were affected. Miscarriages or spontaneous abortions happened in about 10% of these women. So the prevalence is about 30%, and most of it is published. And then the small and medium enterprises, we have about 44 million small and medium enterprises, and which are like actually registered under the MSMEs, and they contribute to about 29.4 GDP of our country. So they make a very important component of our economy, and they work in a lot of informal workspaces where the indoor temperatures can reach about 40 to 45 degrees. Small factories, very poorly ventilated, they trap the heat, worsening the worker conditions for them. And we have studies have shown that there is a 30% drop in workers' productivity that's happening inside these factories. And heat-related productivity loss in SMEs could cost about India billions annually in the lost output. Enclosed spaces, poor ventilation, no mandated hydration breaks, shade provisions or cooling measures, no applicable labor protection, makes it even worse for the small and medium enterprise workers. So, for India, 673 million workers, 93% of them are from unorganized sectors, means their labor protection or insurance protection is almost close to nil. So, there are always certain myths that go around. We should be questioning those myths. Indoor occupations are much more safer than outdoor occupations. And when we go to these various forums in Europe or in colder countries, we have always lived in, India is always a hot country. So people must have been adapted to this heat. Workers are always working in heat, so they are already adapted. So we have evidence to show otherwise. What we did was, in our own study, we looked at outdoor temperatures and indoor temperatures in small and medium enterprises. So by 9 o'clock in the morning, we were measuring WBGTs in these places. By 9 o'clock in the morning, outdoor temperatures were much better than indoor temperatures. And then if you look at the humidity and the heat, everything is just trapped. And the heat-related illnesses problems and the kidney issue problems are much higher among indoor workers. Outdoor workers have the choice to sometimes self-pace, but not the small and medium enterprises or in the formal sectors. Adaptation. Whether it's a sugarcane worker in Central America, or what's happening in Qatar, or what is happening with workers, we can see that body can only adapt so much. If the heat is going to be high and the vulnerability is going to be high, then people will completely fall for it. Evidence is building up. Heat is a buzzword everywhere. People are talking about heat because it touches especially with working population. But there is a need for action with or without evidence. We need to urgently act on certain things. What can we do about it? Something that's doable, feasible, what is sustainable. Climate justice, which is a tabooed word in the US, I see, protecting the most vulnerable, is called climate justice in our vocabulary. It should be by the people, for the people who need it the most. Few things that can actually work is empowering local leadership, secure financing for the adaptation. Strengthen community-based adaptation initiatives, giving local people the tools to take action. India is a large country. The government cannot be reaching every hamlet or a rural sector or anything. So it has to be the local leaders who should champion it. And explore innovative financial mechanisms such as climate bonds, insurance schemes, which has happened already in Ahmedabad for the informal women workers, and it seems to have really made it change, but it was funded by US, and probably we need to find mechanisms to fund ourselves. Incorporate climate resilience to labor laws, work building codes, rural development. Even for the small and medium enterprises, they should be building codes. Develop robust systems that ensure that heat impacts do not exacerbate poverty or inequity. Invest in technology and local capacity to improve early warning system, specifically for working population. Align climate adaptation with sustainable development goals for better synergy and impact. That way, the workers benefit, it's a win-win for the government, for everybody. If you want to truly strengthen workplace heat action plans, adequate financing is required. Things cannot be built from nothing. Establishing legal foundation, how do we monitor things? Who is accountable? How do we do the accountability for what has to be done? Promoting participatory approach, involving these workers and the supervisors and everybody. We have a good case study in near Chennai with a brick kiln, and they have transformed their bricking to something so wonderful that they were captured in the BBC News too. Taking long-term perspective, issue to strengthen the heat action plans. It's not something that can happen in a day. We can also learn from best practices from other regions. Wearable sensors. So environmental WBGT monitoring is one thing, but wearable sensors that actually can alert the worker to stop working while he's going to be heat strained. Stricter labor regulations like in Singapore, Middle East, UAE, Qatar, Saudi Arabia are collaborators that are working. Between 12:30 p.m. to 3 p.m. where the heat is the highest and humidity is the highest, people should be stopping to work. And sugar mills in Nicaragua, where hydration and work modifications in the plantations have been done to reduce the CKDU risk. And we have been a part of that. They have become the torchbearers of this whole region. Central America is full of sugar mills, and they are following suit. Something that should be doable at field level has to be suggested. Outdoor workers, very, very simple methodologies are available. For indoor, it's a little bit more complicated, but it's doable. Hydration has to be improved. And then, of course, gender-sensitive policies. In India, half of our working force in the informal sectors is women. So if we do not consider gender sensitivity, then again we are running the race backwards. Can you play it? Just trying to get a glimpse of what we have. Can you try and play the video? No. It's just a 30-second video.
Last 1 minute?
Yeah, this is the last 1 minute, sir. Are you able to play it? Anyway, this was, I was trying to get a glimpse of what is happening in the small and medium enterprises and how people have to protect themselves. They are working with molten metal, which is about 400 degree, and how they are protecting themselves. Huh? It's okay, don't worry. It's okay, next. No, not this.
I think we got the message.
We got the message. So just last one conclusion slide, that's all. Can you move to the next one? I'm not able to forward it. Froze somehow.
Is it video or is it a photo?
It's a media, it's a video, sir.
Does it look like a video?
Yeah, okay. Conclusion, we have to act urgently, and I would like to quote two great mentors of climate science, climate change. Both of them have humanized climate change more than the science. Professor Todd Kellstrom, my mentor in heat, he says because heat will be worse with climate change, because those who suffer most are the least privileged in the society, and because it can be partly prevented. Next. And Professor Kirk Smith, the rich will find the world to be more expensive, inconvenient, uncomfortable, disrupted, and colorless in general, more unpleasant and unpredictable. The poor will die. The time is to act now. Implementing science-driven policies, worker-forced interventions can prevent avoidable deaths and ensure a safer, healthier, sustainable future worker population. We can go to other planets, but we still need healthy workers to build it. Thank you.
Wonderful and very engaging. You rightly said that these are the people who are mainly from unorganized sector.
Yes, sir.
So, what could be the option for helping them? See, organized sectors you can do with the legal laws and all those. Unorganized sectors, everybody exploits them and nobody is interested in giving them. So what would be the real option for that? That's one question. And I would like to also ask one thing. You mentioned in one of your slides that in migrant population, maximum was urinary tract infection, 67. Is there any specific reason for that?
Sorry, sir, can you repeat that one? Then migrant population?
Urinary tract, UTI was the highest.
Yeah, that is among the women population, but let me answer your first that have been initiated by the government of India right now for the informal sectors. I personally feel that communicating that these kind of programs are available is what is lacking. We conquered COVID just by communicating. So I think we can conquer this as well with the right kind of communication to these workers, that some things are available for them to take, including health insurances, including for domestic workers there are insurances available, occupational health insurances, which is not being widely communicated to these workers. So that is one of the ways we can try and protect them to a certain extent. But again, like I said, when you give the local leadership to these local bodies and try and see if these small and medium enterprises or having certain building codes, having this basic amenities that is required, and then that would kind of reduce the problem a little bit. And of course, use of alternate energy in these places, because electricity seems to be a major problem. We had visited many of these small enterprises where they might even have a fan, but they might have about 3 to 4 hours of no electricity. All these standing machines are of no use. So is there something that can the government at a larger scale do about these things? That's partially the answer. That is not the complete answer. But when it comes to the migrant workers, I was talking about the women workers who were suffering. So the study that we conducted was with women workers, and most of them, 90% of them, suffered because they didn't have a toilet to use. They have to either walk long distances to a bush, or they had to hold on for the whole day before they get to where they were living, the temporary households, wherever they were living. So these cause a lot of issues, especially during their menstruation. So many of these women, when we speak about mental stress, they reported that few days in a month they are not able to go to work because of these issues, and then they lose either their jobs, or the supervisors or the contractors are not happy to employ them again because of this. In some sugarcane industries, sugarcane farms in Bihar and other places, women or even these migrant women are even compelled, I should not, probably that's a wrong vocabulary, are compelled to even have hysterectomy so that they won't have these issues, they can continue working. So these things are happening. So the issue of migrant women, especially because they are moving with families and everything, is becoming a big issue, just not in India, but all over the world.
So my question is, Vidya, you very nicely presented how it is impacting our physiological death, heat, stress and heat-related illnesses. One major question which I also feel, and it is very important to answer, like 95% of our workforce is unorganized sector. So if there is heat-related deaths, which is at the extreme point of this spectrum, how to prove that it is heat-related deaths? Because, all these migrant workers, unorganized sector, there is no ways or means, even if we are going to do such researches, then still we are not able to get the data and it will have other medical legal issues, So in that case, what would you suggest? And the second part, can you please throw more light on heat-related mental illnesses? Thank you.
When you have these migrant workers, when you have these informal workers, many of them do not even have this Aadhaar card, or they are not connected, they are not linked. Linking them all is very, very important. Other countries were able to do it. And our country is really trying. Maybe a workplace card or something that will link them wherever they go. And if they are linked, and the second thing is, we can link people, but is the medical system ready actually to go and recognize that it's a heat-related illness? It's just now in India, in India, especially in Tamil Nadu, Andhra Pradesh, we have started training these primary healthcare workers and primary healthcare doctors on how to recognize identified heat strokes. Otherwise, it's usually documented as a heart attack or something else. So those are all big questions. It might take a longer time, but there is always hope, because things are already starting to roll, and I think it will happen. The second question that you asked is about, sorry, can you come again on that?
Heat-related mental illness.
Heat-related mental illness. There is a new word on something called eco-anxiety. Okay? Before April comes, and then the heat is going to start, you go and speak to workers, just not even workers, talk to even communities, there is some depression and anxiety that comes, which was usually very prevalent when we speak to the Nordic countries. When winter was coming, they would have an anxiety and depression. But now we are having heat-related anxiety because people know that they are going to be affected. People know that they are going to be fatigued. People know that they are going to be having problems in continuing to work, and they have to work longer hours. Brick kilns, all these women and men have to work longer hours to complete their targets, because many times they have to take a nap or a break in the afternoon because they cannot continue working. So all of this puts a lot of mental pressure on these people, and that is what we had documented. Yes, madam.